Birth before the due date. Preterm labor is described as cramping that cause the cervix to open before the 37th week of pregnancy. A full-term pregnancy lasts about 40 weeks. Premature birth occurs when a woman's body prepares to give birth before the fetus has fully developed in the womb, as children grow throughout pregnancy and are considered full after the 37th week, as children born before the 34th week are at risk of health issues such as incomplete lung development and underweight. Premature birth is the most common cause of death in children under the age of 5. If any of the following apply to you, you may be at risk for premature labor. You have already had it. You are expecting multiple children. I had surgery to remove fibroids from my pelvic area. Your cervix is not very long. You had a miscarriage in the second trimester earlier. Premature birth symptoms. In some women, the indicators of preterm labor are impossible to miss, but in others, the signals are less obvious. Thus it is important to keep track of the following preterm labor symptoms. The occurrence of cramping in the lower abdomen more than 8 times per hour. These cramps feel like they are stretching our stomachs and remind us of menstrual pain. Low back discomfort might be constant or intermittent. A sensation of increased pressure in the pelvis or vaginal area. Diarrhea. Bleeding from the cervix. Vaginal discharge of fluid. Contractions or contractions in the uterus occurring more than 4 to 5 times each hour. Thigh pain in the inside thighs. Vaginal secretions have increased. Bleeding from the vaginal area in any quantity. If you have any doubts about the presence of one of these symptoms, especially if bleeding occurs, you should see a doctor very away. Preterm birth causes and risk factors. The following is a list of the most common causes and risk factors for premature birth. 1. Premature birth causes. The causes of preterm delivery are frequently unknown, but this is not the end of the story, as proper body treatment during pregnancy can lower the chance of premature birth greatly. Early birth can happen to any woman at any time throughout her pregnancy, however there are several circumstances when it is more common, and the most common reasons of premature birth include the following. A history of preterm birth. Twins or triplets in the womb. Vaginal, uterine, or placental disorders. Cigarette smoking. Consumption of alcoholic beverages and the use of illegal substances. A variety of other illnesses, particularly those affecting the amniotic fluid or reproductive system. Chronic illnesses such as hypertension and diabetes. Weight gain or decrease prior to pregnancy, as well as a modest or major weight gain during the pregnancy. Life situations that have been stressful, such as a near-death experience or exposure to exceptionally violent life events. A history of recurrent miscarriages. 2. Risk factors for preterm birth. The following are the most important factors. Diabetes. Diabetes is a condition in which your blood contains too much sugar, glucose. High blood pressure. When the force of blood on the walls of your blood vessels is too great, it causes high blood pressure. This can put a burden on your heart and produce complications while you are pregnant. Preeclampsia. Preeclampsia is a form of elevated blood pressure that affects some women during or after pregnancy. It can lead to major issues and even death if not treated. Infections of the uterus, urinary system, or vagina, as well as sexually transmitted infections, generally known as sexually transmitted diseases. Pregnancy-related intrahepatic cholestasis. This is the most prevalent liver ailment that arises during pregnancy. Thrombophilias are diseases that raise the chance of blood clots that are aberrant. Premature birth complications. Preterm labor complications include delivering a baby early, which can result in a variety of health issues for your infant, including low birth weight, breathing difficulties, incomplete organs, and eyesight impairments. cerebral palsy, learning impairments, and behavioral issues are all more common in premature babies. Premature birth diagnosis. Your healthcare practitioner will assess your signs and symptoms as well as your medical history and risk factors for premature birth. You will be diagnosed with preterm labor if you have had regular uterine contractions and your cervix begins to soften and thin before 37 weeks of pregnancy. Preterm labor is diagnosed using the following tests and procedures. 1. Pelvic examination. The hardness of the uterus, as well as the size and location of the baby, may be assessed by your healthcare professional. He or she may also perform a pelvic exam to see if the cervix has begun to open if the water has not broken and there is no risk that the placenta is blocking the cervix. It is also possible that the healthcare professional will check for uterine hemorrhage. 2. Ultrasound imaging. The length of the cervix can be measured using a transvaginal ultrasound. An ultrasound can also be used to check for issues with the baby or the placenta, confirm the baby's position, estimate the baby's weight, and evaluate the volume of amniotic fluid. 3. Monitoring of the uterus. A uterine monitor may be used by your doctor to track the length and spacing of your contractions. 4. Laboratory examinations. To check for some illnesses, a healthcare physician may take a sample of vaginal secretions. Fetal fibronectin is a protein that functions as a glue between the fetal sac and the uterine lining and is excreted after labor. As the urine sample will be analyzed for the presence of particular bacteria, these results will be compared to other risk factors. Treatment for preterm birth. It is advisable to consume half a liter of water or juice if contractions begin to emerge prematurely. The following are the specifics of the treatment. Corticosteroids. Corticosteroids can aid in the development of your baby's lungs. If you are between the ages of 23 and 34 weeks, your doctor would most likely recommend corticosteroids if you are at risk of giving birth in the following 7 days. If you are on the verge of giving birth, your doctor may prescribe steroids. Between the weeks of 34 and 37. Magnesium sulfate, MSO4. If you are at a high risk of delivering birth between 24 and 32 weeks of pregnancy, your doctor may prescribe magnesium sulfate. Tocolytics are a type of tocolytic. To temporarily slow your contractions, your healthcare provider may prescribe an antitocotic drug. This medicine can be administered for up to 48 hours to prevent premature labor and allow corticosteroids to work their best, or to transport you to the hospital if necessary. 4. Surgical techniques. If you are at risk of preterm labor because of a small cervix, your doctor may recommend cervical cerclage surgery. Your cervix is sutured with strong sutures during this treatment, which are normally removed after 36 weeks of pregnancy. Premature birth prevention. The following are the most essential preventative methods. Observation during pregnancy. Throughout the pregnancy, the stages of pregnancy must be monitored by a gynecologist. The doctor assesses the health of the pregnancy and the safety of the fetus via periodic checks. Maintain a healthy diet. Large amounts of folic acid, iron, calcium, protein, and other nutrients are required during pregnancy. All nutritional inadequacies can be supplemented with pre-pregnancy vitamin supplements. Maintaining a healthy balance of chronic diseases. Chronic disorders, such as diabetes and high blood pressure, must be managed in a stable and balanced manner prior to pregnancy, as these conditions increase the risk of premature birth. Reducing physical activity. If indicators of premature birth arise, it is recommended that the pregnant lady minimize her working hours and the amount of time she spends on her feet, and that she engage in any moderate physical activity at all. Stay away from dangerous substances. If you are pregnant, you should refrain from smoking. The use of alcohol and drugs is also restricted, and the use of medication should be supervised, although you should contact with your doctor beforehand. Seek counsel on sexual relationships. If you experience vaginal bleeding or difficulties with your cervix or placenta, you should consult your doctor to see if you may continue to have sex while pregnant. If you do not have these symptoms, there is no need to seek counsel. Lowering the pressure. By establishing and adhering to norms for work, varied activities, and rest hours. Keeping your mouth clean. Cleaning teeth, flossing, mouthwashing, and visiting the dentist on a regular basis are all recommended. Installation. If you have a history of preterm labor or miscarriage, your doctor may suggest weekly progesterone injections.